As a whole, cardiovascular disease is the leading cause of death worldwide for both men and women. In the United States, it accounts for 60% of all deaths annually. This is more than all forms of cancer combined. In fact, every 33 seconds, someone in the U.S. will die from cardiovascular disease. This adds up to 2,600 people per day. Statistics continue to show it as the leading cause of death every year since 1918, which tells me that this is something that I, and anyone else concerned with their own well-being, should be educated about. I'm sure we all know someone who is in the past or is currently suffering from heart disease. I know I have. In 2004, cardiovascular disease claimed the life of my grandfather, and it's for this reason that I feel it's necessary to be educated on what the disease itself is, what causes it, the symptoms and warning signs to look out for, and also what I can do to lower my risk of developing such disease. Cardiovascular disease and heart disease are terms that are used interchangeably to describe the disorders and diseases associated with the heart and the blood vessels, often both. To better understand what cardiovascular disease is, it's important to know what all the terms classified in this disease mean. Congenital heart disease is specific to heart defects that one is born with. Arrhythmias occur when a person has an abnormal heartbeat, whether it be slower or faster than normal. Heart failure is when the heart does not pump as well as it should or as well as it once did, and cardiomyopathies are diseases of the heart muscle itself, often characterized by an enlarged heart. Though each of these specific types of heart disease have their own unique symptoms, they can all be characterized by similar warning signs. According to the staff at Mayo Clinic, the more common warning signs to watch out for include chest pain, shortness of breath, lightheadedness or fainting, and numbness or coldness in the arms, hands, legs, or feet. Untreated symptoms of heart disease can lead to stroke, heart attack, aneurysms, or sudden cardiac arrest. And this is why the professionals at Mayo Clinic urge anyone who develop any of these symptoms to seek emergency medical care. Now that the term heart disease has been defined and the warning signs linked to it have been presented, one needs to understand what triggers or worsens the onset of cardiovascular disease. With the exception of congenital heart disease, which again forms before a child is born inside its mother's womb, many different factors can contribute to heart disease itself. Causes of cardiovascular disease can be broken down into two categories: modifiable risk factors and intermediate risk factors. According to the World Health Organization, the main cause of heart disease, or the modifiable risk factors, include unhealthy diet, lack of physical exercise, and tobacco use. The intermediate risk factors, those are caused by a combination of an unhealthy diet and lack of physical activity, consist of raised blood pressure, raised cholesterol levels, and obesity. Other risk factors that can be contributed to the cause of or worsening of heart disease are a person's age, sex, heredity, and the presence of high stress in one's life. After examining the contributing causes of heart disease, it can be concluded that there are ways to prevent it from occurring. Researchers at the World Health Organization found that 80% of all premature deaths associated with heart disease could have been avoided through a healthy diet, regular physical activity, and no tobacco use. Though congenital heart disease, such as a heart murmur or enlarged heart, cannot be prevented, the other disorders classified under the term can be controlled by maintaining a healthy lifestyle. Besides choosing a diet that is rich in fruits and vegetables and low in fats, sugars, and salts, the best thing one can do for themselves is to quit smoking. Or better yet, never begin. WebMD claims that smokers have twice the risk of developing heart problems as that of non-smokers, and if they do suffer a heart attack, they have twice the chance of dying, as does a non-smoker. The American Heart Association points out that smoking is such a significant risk factor that the Surgeon General called it the leading preventable cause of death in the United States. As with any preventable disease, regular checkups with one's doctor, along with monitoring one's blood level and cholesterol levels, can help to detect and often prevent the onset of cardiovascular disease. Although there are certain risk factors that cannot have any control over, such as heredity, sex, and age, there are ways to help lower your risk of facing the fatal threat of cardiovascular disease, as we've already discussed. Being the leading killer in the United States by a landslide, one can benefit greatly by taking heed to the information just presented to them, including the definition, causes, symptoms, and prevention of cardiovascular disease. Before I conclude, I would like to revert back to the beginning of my speech, where I mentioned how every 33 seconds someone dies of heart problems. With that in mind, during the 6.5 minutes that I used to make you, my audience, more informed about the topic, 13 people in the United States have died. I hope that makes you realize exactly how many people are affected by the disease itself. Life is a beautiful journey. It's something that one should cherish and take full advantage of. In order to get the most out of life and enjoy all life has to offer, it is important to take care of yourself by taking precautions to avoid such life-altering traumas as heart disease.